was with you for the last 3 lectures. I think this is a lecture which will wind up the matters on sterilization. I just want to tell you that sterilization is one of the oldest practices to save the humanity and still continues, and there are a lot of recent advances. So what is the most important message to everyone is sterilizing properly. It is the things. We do it somewhere in a shortcuts. Sometimes we are doing overdoing, sometimes we are underdoing. Why the sterilization is important, I will be talking to you in that. Everyone knows Samuel Willis, we thought about it. 1867, the modern surgery has started. Previously, when the surgeries were done, people are used to die with the gas, gangrene, tetanus, and so many complications. But he continues to be a mentor to change the things. And carbolic acid was a very crude way he used to use it. And Johnson & Johnson company came into the facts, into the marketing things. See, Johnson & Johnson continues to be one of the oldest, and in 1880 it started its surgical dressings. So infections are a great threat to any patient. How safe are our hospitals? A country like India and developing countries, we don't have any grading of the hospital about safety. It depends, you know very well the limitations. Hospital-acquired infections can develop, which can create a whole new set of problems for patients. According to the Center for Disease Control, hospital accounts are often preventable threat to patients' health and overall. See, as you think everybody goes to save the life, reduce the mortality, we go to the hospital. If you take to the hospital, all the people who go to the hospital may not return in a good form or may die also. So what the CDC said about it is there. You take, because we don't have any grading or any open access to see a patient gets admitted and gets into complication, and it will be dealt by multiple people. But the CDC has make it, the hospital infections are the most important. The what you see most is the catheter related infections are very common. Because if a person first, a patient who is on the bed, is the most important procedure they do it is, you go to any hospital, they will put a cannula, that means to a lifeline. It is done in a hurry, it can infect a cannula, we just put for IV drip running, it can also, and urinary catheter, you know, and you have seen recently, the most important is the surgical site infections and the ventilator associated pneumonias. See, the major cause of the death in the COVID patients is a ventilator-associated pneumonias. I will come to the facts. Ventilator is, there are so many issues about ventilators, and a doctor advises a ventilator, and it entirely depends upon the staff who carried it. Once a ventilator is put, the life is at the edge. There is no doubt about it. You take US also, many people die with a ventilator-associated pneumonias. And some people refuse an ICU treatment. Some people may say, don't put me on a ventilator, I write a will also. So it all just, I will be heading only. Long hospital stays. Suppose somebody has been there in the hospital for a very long time, certainly to catch some infection. Particularly take the case of a burns patients. The most important cause of death in the burns patient is primary stage is overcome. Most important cause is death, and the most important microbe is the Pseudomonas, whether somebody likes it or not. So what really happens, increased cost once a person is admitted, if somebody gets operated for a hernia, he gets infected. It may be just a hernia operation may be costing about 30,000 rupees, but he may shed about 70,000 rupees for only antibiotics. You know the costs of meropenem and all. Last wages, say a poor man gets admitted, the entire fortune is gone. You take a laborer and he is the only earner and they have to shell out. Death is the most important thing. Now, one thing is there, I put it in the death is there. People are living long. And ultimately, you find, take this thing, they will declare that this person has developed a septicemia and died. So there are so many facts from the entry, patient's life tickles from the time he enters into an ambulance, enters into a casualty, transferred to a ward. So just information. These are all most resistant bacteria. These are all some of the gram-negative bacteria are becoming very important. As you read recently, they were also worried about Candida auris is also coming into this one. And surgical site infections are second most common cause of hospital-acquired infections. These complications of surgical cause considerable morbidity and can lead to mortality as high as 77%. See, I know some surgeons, those who are good, particularly you take a cardiothoracic surgery, and entirely they cannot operate without a good infrastructure. What happens ultimately? He becomes unpopular. Suppose there were cases of a mitral stenosis, a very simple operation. The person dies after a mitral stenosis, or you take an appendicitis. Person has undergone appendicitis. A wonderful surgeon has come and operated, but not managed well. This is also. See, there is nothing like you find the most important thing. There are two people there. Every picture contains some meaning which I create. Cleaning more important than disinfection and all these things. Suppose you take a patient is vomited or something, a child has passed a stool on the floor. The antiseptic agents are of not important. It is only to first cleaning. Organic matter, if it is there, microbes will be this thing. However, cleaning removes contaminants, dust, organic matter, and disinfection reduces the number of microbes. So recently there was a lot of cross infections and co-infections in case of COVID. There was no time and the patients are in waiting when the next bed is empty. This has caused not only just related to the COVID, but also it is also because of the co-infections. There is no time to clean this bed and the patient is admitted immediately after discharge. So reduction of the microbial content is very important. Very rarely the microbes reach the operation site. This is also very important. See, you do it with a little water and a bleach is sufficient, because you need not do it, overdo it. Somebody is cleaning in all these things. And you do it with the cleaning that is excellent. Don't waste much chemicals. And paying great attention to floors using unnecessary or too many not necessary. Because if you take a person in an operation theater, he will not come in contact cardiac surgery on the microbes on the floor, but on the hands of the surgeon and keep the floor clean and just an important inter. And some people you find morning everybody comes and disturbs the walls and all these things, not necessary. If you are going to use and the morning before the surgeon comes, all the microbes which are sleeping on these walls, they wake up. And if you are unnecessarily disturbing the side walls and all the microbes will fall down and the floors gets contaminated quickly. So it is also very important that you don't overdo it and you just don't do, even also do not disturb unnecessarily roof also. Suppose there is a roof or some lighting and all, just don't do it. If you can do it once in 3 days or 4 days, because the microbes here cannot fall on the unnecessarily. Clean only when remodeling or accumulate roof once, in the sense the real roof of the building. How you care for the floors? Use only vacuum cleaners. Do not broom, as it increases this thing. So now you should not use any broom in the healthcare areas. This is also a great change. Even if you go to public institution, the sweeper comes and brooms all these things. If it brooms, all this, what happens? There will be the particles will be microbes and the particles will be scattered everything and fall around many of the instruments around the patient. Cleaning of the simple detergent reduces the floor by 80%. Addition of a disinfectant 95%. And what all you do within 2 hours, the bacterial counts start rising. Because I told you also last week, the people walking with the bare chappals on the road, entering into this thing, what are all wonderful things you do it. That means you can never sterilize an operation theater absolutely. Microbes will be visiting every time when somebody visits to this thing with them. This is the one of the things, because I told you I don't want to go into absolute sterilization of the operation theatre is impossible anywhere. This one that is only needed in some places, particularly if you go to a bone marrow transplantation. I was working in Apollo when they built on the the Mount Road, they built one cancer hospital primarily. Now they changed the name. The first I was there in 1993. We have this thing, HEB, all the bone marrow transplanters should have absolute safety, and even few particles, coliform particles are very dangerous. We are just talking in relation to common operation theaters. I will talk to it about the end when you come to modular operation theaters. Do not waste chemicals. Only remove the dust with a cloth wetted with a clean water. Do not use this. All finished. Negative air pressure vented to the operation theater. So you all know now nobody uses fans or the old model air conditioners. There are all these things now. The contaminated air, just HEP filters are all coming there. So coming back to the fumigation. See, if you take, I think when I was around 10 years, up to 1978, the smallpox was very, 78 it is eliminated, as all of you know, that whenever a person with in the sick with, actually fumigation started with the sick rooms. People are there with some communicable smallpox and all. They started doing a fumigation to this one. That means that. But I don't know how much fumigation helped, because in the smallpox and anyhow smallpox, but we are stuck with the fumigation. And India, if you ask me, last week also I told 80% of the people do a fumigation. Formaldehyde is a age-old compound. Low temperature heating produces vapor. Vapor phase decontaminates the air and kills vegetative spores. How much time? When formaldehyde mixed with the water, it produces a vapor and thoroughly clean. See, fumigation we are doing, I want to tell you, many doctors may be there. We are doing fumigation half-heartedly and no-heartedly to the staff. First thing is there, we have to clean all the windows, close the windows so that no air should be leaking from the operation. That is impossible in the old setup. When somebody starts fumigating, all the people around will be exposed. Switch off all lights, air conditioners, calculate the room size. I will come back to you. We are just randomly mixing. We are not actually calculating how much formaldehyde is there. The first priority to a fumigation is when a new building is constructed, new operation is this thing, or a painted, we are going to use a fumigation. Then you don't worry about it. Have you see? We rarely come across somebody developing a gas gangrene in the operation theater or tetanus. Suppose somebody asks me a question, why tetanus is not coming in the operation theater and all these things is because we are all vaccinated. And there are some doctors particularly when there is an injury on the roadside, they give a tetanus toxide. And you may ask me, we are misusing tetanus toxide also one way for all the doctors. We should not take very frequently tetanus toxide. It is effective for about, because it is costing about 2 to 3 rupees. People take too frequently tetanus toxide. Please remember, taking tetanus toxide can produce Guillain-Barré syndrome. Actually, if there is no major injuries, once in 5 years is sufficient, or 10 years, but in the elderly people, you have to do it, immunity goes up. Creating formaldehyde gas. What are all these things? Formaldehyde, we have to mix with the water and heat it. Then you have to please remember, I also told you, you have to measure. You call your engineering department person, you please ask them to calculate how much cubic feet is my operation theater. Then for every 1000 cubic feet, you have to take 500 ml of formaldehyde and add it to 1000 ml of water in an electric boiler and switch on. And you, after 45 minutes, variable depending present in the boil, switch off the boiler. Just heat it for about 45 minutes and you just automatically it gets off many of this one. And you have to come out because the people who are starting that one, all they may be going to the very high content of this one. And you can, if there is no heating method, you can add a potassium permanganate and see, neutralize. I also last week also told you do this one formaldehyde, and after 24 hours we have to use about ammonia, neutralized ammonia by 500 ml. Formalin you have to use about 250 ml of this one, and you have to expose it to the room for 3 hours. So I just want to make it a point. Suppose if you are doing a fumigation in the morning and you are starting the operation theater in the evening, there is no contact time with the formaldehyde. You are doing just for the habit, but not effective. And what is the disadvantage is there when the turnover of the operation theaters is very fast, and you cannot really, this formaldehyde is really no use at all. You are just for doing it weekly, you do it on Sunday, Saturday if you do it, Sunday is a holiday, there is some exposure. This is what happens. We do it in the morning, we think the operation theater is sterile by evening, and also we nobody, few people does ammonia neutralization because that reduces the formaldehyde effect on the people next day who are coming. This is you can see to the chart and you have to calculate how you made it and all. Formaldehyde, a harmful chemical. International Agency for Research on Cancer is a part of the World Health Organization. The major goal is to identify causes. As concluded, the formaldehyde is a carcinogenic to humans based on the higher risks of naropharyngeal cancer, leukemias, and the Environmental Protection Agency AP as a classified formaldehyde probable human carcinogen. There is a difference of opinion. If you ask me why we are not eliminating it, they are the most shortcut, because the cleaning the operation theaters, I worked for some part in a British hospital built by British in Africa, where the hygienic conditions are very difficult to get. A clean water is there, tanks are not cleaned for a very long time. So many things can happen. You also know very well through the air conditioners, even the water used for the air conditions in the hospital may get infected, and the humidifiers also can, humidification causes spread of infection. So you just, if you find you make a survey in your hospital with the technician, these are the common symptoms, and these are all the standard slide produced by the environmental health. So these are all not important, but the important is eye and nose, this one. Lowest feasible limit, you have to just formaldehyde. Great question, why still use it formaldehyde? I want to tell one thing is there. These are great questions which are not answered by anyone properly. But nobody, if you go to a public institution, they have a little resources, and the formalin is the only thing which they can afford with the available things. And also another thing is there, formaldehyde is, if you just desire, not a comment, formaldehyde is a thing which is not stolen from the hospital. That is one of the developing countries you find it. Suppose very valuable, somebody may steal a soap, but this is one, in the one conference, when senior doctor told previously the country is this thing, people were this thing, so they are deserving, and people are very careless, and they are cutting the soap into two parts. These are all the issues which may happen many places in the developing countries. So what this thing is that you find a green, this one, the world want to grow green, and the need for non-aldehyde based chemicals. As you told last week also, I told formaldehyde and glutaraldehyde we are using for need for quicker sterilization methods with the ever increasing workloads. So you go to a corporate hospital, they cannot keep the operation theater idle for one day because they lose a lot of money. You know, some of the doctors may be working and they do cost accounting. Suppose they invested 10 lakhs in an operation theater, it will be the passed to them. And this is a very important message. Need for non-toxic safe chemicals. Several chemicals are available recently. One is formaldehyde-free disinfectant. Very good cost-benefit ratio, good material compatibility, excellent cleaning properties. Actually, this one. See, whatever it is there, I am not promoting any one agent or not this thing. Active glutarol bacillus seed also contains glutarol 100 milligrams this one, and other chemicals are there. Rasant is suitable for the disinfection. It is little better than formaldehyde, but still it has become in a more refined form. It became famous for some time. Some people are using, but with the onset of the modular operation theaters, people are going to the other person. So you whatever you use. So I told you, Vircon is becoming a biocidal bactericidal. It is also a good product, and it has been a European Union also very much. If you go to Europe and all, the most important this thing is their chemical disinfect, medical devices, laboratory equipment, become spillages, blood and all. It has got a wonderful thing, but cost is this thing and all is imported. Is one of the good German product which is still available. Next is coming to the vapor sterilization, intended for condensing vapor systems, liquid phases present. Presence of multiple phases, these are all the cycle of events when happen and all. I will coming to this thing a little later. Radiation, these are all not actually, some only, it is not actually routinely we are not doing radiation and all these things. So the most important problem with everything now, as you see, the endoscopic surgeries are becoming very much this thing. You see a very complex endoscope, and you go to in 2005, Jubilee Mission Medical College has purchased gas plasma sterilization exclusively for the endoscopes. They have got 5 endoscopes, and they have got nearly about 50 patients. So it is not possible to do by other methods. I mean, fast rotation is also still difficult. Ethylene oxide is also used, but the safety is concerned. They have to use this one. Very complex, and it cannot be destroyed by anything. Dealing to prevent the spread of healthcare associated infection, endoscopes, bronchoscopes. See, if you take you take a non-interventional and interventional, and most of the non-interventional things, you see, if you some of your people laparoscopic surgeries are done very frequently, and some get infected. When the cycle of events are not good in sterilization, people get infected. We have seen in the place in Karnataka where I was working, so many people after this laparoscopic tubectomy developed atypical mycobacterial infections. I don't know, because of the improper sterilization or the water contamination or the carelessness they are putting a Sidex, and that Sidex also even after lapse it's this. And this is why sterilization endoscopes are routinely exposed to the mucus and other gastrointestinal, the blood, saliva, this one. And the sterility is very important. Please remember, most if you are doing a respiratory scope or anything, that most important is somebody may be tuberculosis. It needs a longer time, and the time we are putting in the Sidex may be very less for staff and all these things. So I just want to tell you, I am not giving very great detail. When you are using a chemical, it comes with a literature. So please, all the doctors, when you find a equipment, you buy the equipment and keep the literature in the file, because every instrument has its own specifications about the different organisms. So ethylene oxide sterilization is an alkylating agent which reacts with the DNA and destroys the ability of the microorganism to metabolize. So the method of choice for many heat and so many endoscopes and all, this is a very good mission by 3M. And if you are buying this mission, you have to have the specific literature, because these are all closed systems. They prescribe with their research. They will tell you how much staphylococcus, how much a colonoscope. So if you take a colonoscope, it will be having lot of fecal contamination and bacteria and all. The time of sterilization may be less. Suppose if you take a colonoscope, the time of sterilization is much less than a bronchoscope, because bronchoscope can contaminate it with the tuberculosis. So I cannot say this is a method which is very important, that method is not important. Absolutely, this is a, see, somebody may ask me this one, one can learn this about sterilization in 1 hour or 1 day. It is not there at all. There are, there are people who work, and also I want to tell our friends, there is an international journal on the operation theater. That is one of the exclusive general on the operation theaters. Only the people, everything which will be dealt and the changes of the world which is been, it will be there. Effectiveness of effective ethylene oxide sterilant depends upon the concentration of sterilant, relative humidity, temperature, exposure time. See, now everybody want to reduce the time. Anyhow, now there are systems coming. Everything is locked. You cannot off it half-heartedly before that one. Only it is a built-in software will be there. It will get only off after this one. Suppose if you are using an incubator, you just open the door and you can start doing without fulfilling the regulations. Next is coming the plasma sterilization. Plasma is defined as the highly ionized gas composed of ions, electrons, and mineral particles. Plasmas are generated by introducing precursor gas or vapor, hydrogen peroxide or parasitic acid into a chamber under low vacuum condition and then exciting the gas or vapor. Suppose you see hydrogen peroxide was the oldest chemical disinfectant. Suppose some of my classmates or my contemporaries, so anybody coming to the hospital in the past, they used to wound, they open and they used to pour hydrogen peroxide. If you take back to 40 years back, the people losing their life, limb with a diabetic foot was very common. A lot of studies has proved when somebody comes with the early stage of a diabetic foot or ulcer or infection, they used to pour hydrogen peroxide. This was a very damaging the tissue, growing tissue and also surroundings. Now, the same compound has come into the most fantastic use in the future use, today's use. This is a hydrogen peroxide, a very, very simple compound, has become the most effective sterilizing agent by technology. Why plasma sterilization? The process usually at room temperature and hence poses no danger associated with the high temperatures. Suppose if you are why you may ask me why at a room temperature this is sterilizing an endoscope. Suppose if you are going to increase the temperature or exposing to this thing, the lenses get damaged and all. They have got the most complex things are coming there nowadays, and even maybe costing lakhs of rupees. And see the place where I was there in Swims Tirupati, and in 1990 itself, they invested lakhs of rupees on the endoscopes. So Dr. Shashidharan, I think the people from Kerala may be knowing, and he is one of the very eminent urologists. He has purchased a lot of this thing in Swims. And the most complex, there are people used to come from many places because they have got a very advanced technologies of these endoscopes and all. And so suppose if it is a 5 to 6 lakhs or 10 lakhs or 15 lakhs costing endoscope is gone, you can just imagine. So they cannot lose it and they can use this one. And most important is there at the room temperature, it will not get spoiled. Suppose a question to anyone who can sterilize anything at a room temperature is gas plasma, low temperature, that's what I told, glass vaporized, and plasma was patented in 1987. This is a Johnson & Johnson is doing it to add many hospitals. Plasma cycle time is approximately 75 minutes and there are special packing needs. And just say you hand over the things and you can just get it back very soon. You see that one, if you, it cannot be anything lesser than that one. Disadvantages of plasma because everyone cannot have it. Suppose if they are going to buy it in a government hospital when their service may be difficult, it has got a weak penetrating power of the plasma conveyor and the presence of an organic residue, packaging material, complex, bulk sterilization of many devices is very difficult. Suppose you cannot do a 50 endoscopes within 5-6 hours. And also, one thing is there, suppose there must be a first step of cleaning to remove. Suppose you put some scope into the bronchoscope and it is contaminated with the sputum and all this. We do not know whether the patient is having a tuberculosis or AIDS or whatever it is there. Even HBsAg also can transmit through the blood contaminated materials. Surgical site infections, that what? It is an infection occurring in a surgical site within 30 days of the operation or within 1 year. The definitions I am not very confident to tell about it because the surgeons form entirely things in a different. And also in appendicitis operation is different than from the replacing a hip or a knee joint. So somebody has been putting a knee joint and both the legs, this thing operated. So the insurance company will ask how long you can take care of this one, how long we pay the money if there is any infection, who is liable for all these things and all. So the definitions are changing. Tomorrow somebody may come, we have got the excellent process and it will not get infected. So surgical site infections, there are not much this thing in our timing. I mean, this thing, somebody, even up to 3 months, you can do this thing. And particularly, please remember, somebody meets a road traffic accident. I will also come down to that one. And they have done a emergency nailing or a plating and all these things. The most people lose the limbs even after the surgery. It is because of the infections arising out of the things. And surgical, the source of maybe endogenous. And see, suppose somebody thinks, last week also, we are cleaning, and suppose somebody getting an operation on a hernia or abdomen, we are cleaning first with the alcohol, then with the betadine, once again with the alcohol. 3-step sterilizations are there many times because, directly they don't use many times. First they will reduce the count, then they use a betadine and all these things. Who are very allergic, they are doing it. So if you are not cleaning properly, the first primary site of surgery, what happens? Our skin on the abdomen or anywhere contains staphylococcus, like simplest staphylococcus is the epidermidis. It is present on the skin. So after some time it can get infected. So cleaning is the surgical site infection. The first step of getting a patient infection is the step here where you do not clean and you are doing in a cursory way. And in USA, 1.5 million is sometime back only. And hospital losses, suppose somebody suppose you go to, when I was in Apollo Hospital, Chennai, a package deal now, that after 7 days, you are eligible for all treatment for 7 days. After that, you have to pay. Then the question comes, patient is there. You take a simple example of a lady gone for a delivery, and the normal delivery, and they catheterized, mother is okay for 1 or 2 days, then this thing. And the definitions of the days are different. After 3rd day, the patient gets a fever because the improper catheterization, not taken proper care. And they say, this we cannot discharge. Then the question of conflict of interest comes. Doctor told it is only 3 days and you have to stay back. Then who will the, these are all the things, millions of dollars are in the US. It's not that we may think that in India it is a very common. No, it is common in USA. The carelessness remain the same in some people, maybe, and sometimes we are more careful than the people in the Western countries because it is a personal reputation is very important. As organization rarely supports the individual. Suppose a person may be more careless and more dangerous in a developed country. This is all the things which remain with this. So, which are all the most important is the cardiac, I put it. Suppose coronary bypass is the most important, colon in the hip, abdominal hysterectomy, vascular surgeries. These are all the things and fraught with surgical site infections. There are people I know very well placed, one very senior doctor, and he worked as a DME, Director of Medical Education. He went to a famous hospital and he lost the sternum, totally infected. See, I just want to tell one incident about this staphylococcus. I was in Apollo and Dr. Girnaz was the surgeon, and a patient was from King Birendra was the king at that time in Nepal. He came to India to Chennai hospital to get a surgery. So what happened after a wonderful surgeon, Dr. Girnaz, but the infections can happen, staphylococcus. Once again, a report comes. Then we have to think about it. Suppose a VIP gets a staphylococcus infection, and I also know this is very much, there was no phone and there is no only fax and all these things were there and all. So we have sanitized the situation, and it was a meeting with the microbiology and cardiothoracic surgeon, so that how the VIP life counts. And about the DME, I told he lost the sternum, totally infected with the staphylococci from a very this one and all. So he has put a very, there was no much replacing things are there and all these things. You can just imagine a man without a proper sternum, how the heart beats and all these things. Now there are so many artificial things are coming. So any surgery, patients can get infected. So further classification, this is a very much this thing and all. As a doctor, I just want to tell you, the most important injuries we get in the hospital are also somebody falls from a bike and he just puts the hand on the road and his hand may be this, there may be tear here on the palm. You find you make a classification of, not the classification, study of the roadside traffic incidents. People are not covered like a car and he falls on the road, carries a lot of dust and soil in this wound. And if you are not cleaning properly, first point, with a distilled water or a sterile water, you are introducing this one. And a house surgeon may start suturing this wound. And many people lost their hand because of the improper. You should not suture the wounds. So what I mean is their surgical site infection is not just bacteria, but these are all the critical cases. And I've seen a lot of people fell from this one and hand get infected. Ultimately, this is one of the, I was also assessing some of the disability panel also. The most important injury happens to the hand, immediately somebody want to support. So you should not suture without a surgeon. So this one, and you go to a small PHC and all, immediately they start suturing without cleaning. Please remember, whatever the disinfectants you use, it is no use. First you have to clean all the soil which has entered inside into this one. You just suture it. You should not suture it first without any, you should only approximate all these things. So this is a matter of surgery. These are all the bacteria which can, and I have a friend, very senior microbiologist. He underwent a cataract surgery. And please remember, we all suspect the routine bacteria and everybody mistreating him with the antifungal things. He lost the eye. It is because of the Candida albicans. Somebody may put, see the statistics as, I am very happy, the statistics I have put it as a 6.5%. Please remember, if it is an eye surgery you are doing it, you are using a wonderful thing. And the most important, we may miss Candida albicans in the routine laboratory patient, and he lost, and he spent nearly about 5 to 6 lakhs or 10 lakhs to get back his sight, this one. So it is also, the state is not for all the general physicians, but the medical professionals. Whatever the surgery you do, it is see, camp, we are doing a lot of surgeries. Recently there was some in Bangalore, they have done the eye surgery in a camp, and many people lost the eyesight. Please remember, hospital, because they do it as a mela and they do one day as a target, 38 cases and all, and sterilization field. And Dr. Modi was one of the pioneers. He brought to the villages, this Modi's surgery was there and all. He has got a lot of control, because a lot of variables today, the camp surgeries, people are not fulfilling and they are becoming unpopular of getting the things because of these things. Because you take two things which happen, that they conduct the laparoscopic sterilization for the women in the camps. That also is fraught with a lot of sterilization problems, even eye, which is got biosafety in surgical dressing rooms. So this is my one of the favorite topics. I talked to this one. I made some programs for the African countries. So I told last week also, your operation theater is very important. You do 100 important people are posted going, but the most neglected part is the operation, the dressing rooms. So wash your hands, I always say. Clean the trolley using the water. Start the top of this one. Place the sterile dressing procedure pack on the top of the trolley. It's very important. And I had a very nice opportunity to work in Jubilee Mission Medical College. Whenever a person after going for a dressing comes with an infection, lot of pouring is there. I used to go to the dressing room. I used to see how the nurses are doing the dressing. This is all I just want to tell you. Our talk after 10-15 minutes, we may be disconnected with this one. This is a very, very important thing which is happening. And the first is because of the human negligence, human no knowledge. That is also very important. I just made this program to one of the South African university. It can be separate program is there. Every step is very important. And I always tell, maintain the dressing room as important as your own operation theater. You take some of the operation dressing rooms, they post some nurse who is not listening to anyone as a punishment. And they send the medical students to second year, third year to the dressing rooms. They really does not know anything. And the popularity of the surgeon, if you take a cardiothoracic surgery, at least out of the 10, 1 or 2 doctors will be out of the job if they don't take care of their infection. He is an excellent surgeon. But there are, if suppose you see into a great corporate hospital, the surgeon will ask, what is the infection rate here? Then only he will decide to join. If the infection rate is very distinct, so it is not a topic that somebody wear a glove or anything and all. You have to keep a watch and you have to keep a surveillance. So before changing the dressing, you must wash your hands. Now that you are dirty, bandage important. Somebody you dressed and you do not wash the hands, what happened? Previous person's flora will enter into this one. And the next person, by the time you do 4 to 5 dressings, and most of the last person will be at the receiving end. And you see, septic cases are posted last in the operation theater. What happens? This person, the person, even though he's not mild infection, he becomes a septic because the person who is not washing the hands will ruin the life of this person. See, cleaning the incision, use soap and water to gently clean the incision. You do not have to use antibacterial. Do not scrub the incision, remove the scabs, or attempt to clean this one. You just do a little like a cleaning. Is a small wound is there. You just open, there is something on and all. You are doing a dressing, you just clean around it and it becomes a wonderful result. And you think you are in a hurry, I put some Dettol solution or a Savlon solution. No, because not only this one, there is a new tissue is growing that all will be destroyed very soon. Wash your hands before starting the dressing change. This is a great board you have to keep in the operation theater. So clean your hands. So major principles of wound dressing, use a standard precautions when using a swab, clean the wound. And already I mentioned everything is there. So open the sterile pack on top of the trolley, open this one. This is how you pick up. These are all, this program I made, there are some, you can search to the net and you get one program is there, about 30 slides are there if you are going to teach the people and all these things. So you cannot take anything and all see how simple pictures we can change the attitude and this thing, not complex. Complex things, nothing can be done. Patient will meet his own fate. But simple things are involved. I was working only on the simple things because 90% things can be improved. Because a person, suppose somebody is a cancer patient doing the dressing, not only because of the dressing, because of the education. Suppose a normal healthy person, recently there was a case, one of the professors of community medicine in Kerala, she had gone to a hospital and as a small incision for the dressing, boil, just doctor told, I will do a dressing on the chest. And what has happened is that it got infected, very careless dressing. And she has to spend nearly about 50 to 60,000 blindly on the antibiotics. One not working, no proper microbiology help and all these things. It's not that it helps to a common man, even to the doctors it can happen. I am telling because I was much caring about as a senior person about the events on the seniors also. So sutures and staples will be removed, and also this is also sutures, how you this thing and all. This is very important. When you suture, if the people gets infected very much, common. See, there's a double trauma is there. Not only this one, you are twice you are piercing the tissue around with a needle, and it depends upon this one. And there are so many times are there. I been recently in the college where I was associated. There are also people are coming. The sutures coated with the antibiotics and all these things to reduce their comparing. And see, they're all add to the double the cost. And but whatever it is there, we found a human, a good nurse doing a dressing without anything, a lot of good things will happen. So prepare yourself for the next action. So you've done it, keep the new dressings inside the sterile container. Software tool, I think, Mary, it is a very, I used to work in Africa, Gambia. We used to have Dr. Sharma. He is a consultant surgeon to the University Lusaka Hospital. And he's from India, FRCS. He is from UK. He is migrated to Gambia and South Africa. So whatever it is there, whenever a patient comes after his surgery, we used to take in a similar model and that software tool and all, they are all applied. This makes this thing. You cannot just hand over this thing. So cleaning with the surgical wounds, I told you, and all. Disposing, these are not very important. See, you should never open this one when some other patient comes. See, there can be fan is running, errors can be produced whenever somebody has got you are disposing. See, now you find there are some regulations now. Previously, outside the hospital, they all these septic bandages. This is the source of infecting the environment and also the people. See, the most, suppose if you are throwing the bandages and all on the roadside, what is important is there that scavengers and all these things who are doing it to this one and all. Now there is a lot of changes. There is a different. So report any urgency. Then is there now? See, now getting a, suppose if you take a COVID time, it has become very difficult to get a doctor's consultation. Suppose the elderly lady going to the transport and all these things. So there are so many things are happening. I will just tell you about it. You take a picture of this one, send to your doctor. They are doing recently also. Now it is becoming a digital area. And the patient is also, I will come back. Again, if you have smelling water and all these things, patients are given. A smartphone application called as the wound core is successfully enabling patients. Suppose it is not functional, this software is not functional in India, but in Europe, in USA, this is functioning. They made a software called as the app you can take. Suppose somebody has gone infected and they will load this app into the patient. And you take a picture, and through that picture, they will be there. They will be scanning every 24 hours. They are scanning. By seeing the wound, they will call to the hospital. Whether you come to or not, they will advise. There are so many apps like that are coming in US, but they are not accessible in India. But soon in India also, this will be. Suppose this virtual thing is going to continue. We have to depend. Because suppose you think about a person 50 kilometers you have to travel for a wound dressing to a good hospital or to the hospital, this thing, only necessary this thing. See, this is called as the app was developed by researchers from Wisconsin Institute of Surgical Outcomes, WISCOR, Department of Surgery, University of Medicine. So they are been, it is one of the very popular, it is becoming, it has been quoted in the hospital journal also. See, provide the patient with some dressing management education. This is there and all. This is a nice picture. You see, somebody has got, you are just like teaching how I am taking a BP, because in developed countries, whatever the procedure you do, you have to teach the people, even in good country, even in South Africa and all, they have to tell the people why I am doing, what will happen, whether I am doing a quality and all. Even when you are doing a dressing change also, you have to tell the patient, this is the status and all. Patients want to be informed. New sterilization methods. See, new disinfection methods include persistent antimicrobial coating that can be applied to the environment. And there are so many chemicals coming there and all. This is a catheter where a outer layer contains an antibiotic or a chemical. When they are introduced, it will reduce. I doesn't have any practical thing. Antimicrobial catheters have been proposed as a method to prevent catheter-associated and are worldwide, although their clinical efficacy is not well known. Randomized and quasi-randomized clinical trials have demonstrated that antimicrobial catheters do increase the incidence of this one. This is also very important. What happens there? It was a boom sometime back, 10, 15 years back. Every many catheters are coated with this one. See, you have a very little amount of antibiotic or an antiseptic. So it is easy that people can develop a drug-resistant bacteria because they are exposed to a very little amount of antibiotic. You know very well, unless a good concentration is given, it is not possible to do. So now you go to India, is so much fast developing. Modern operation theatre is a new trend in operation where cleanliness and sterile conditions are to be maintained at all times. We achieve sterilization. So it is a closed system. You see an operation theatre in Kerala, you go to there wherever there is an orthopedic and the bone and the joint, all these things. See, very little things are there around it. Only if you need only, they can be taken, brought, and everything will go back to that one. That means the contact time between the infection and thing is reduced. That is the first principle. And it is a very hygienic and all. So about the sterilization and all these things, you cannot use whatever it is there. You have to use only prescribed by this one, because everything is sensitive to either a chemical or this one. Operating for which the most integrated function is required. Cleanliness may be kept and safely. This is a very important thing and all that. These things, how the patient, everything is monitored through the computer, and just there will be nothing which will be misused or anything you cannot keep. And also please remember this modular operation theatre, also they will be inside CCTV is there. Suppose a surgeon cannot just remove his apron and throw it on the floor or anything, as it was happening in this one. So nothing can be there, even if one or two things cannot be there, and it has to be centrally air conditioned. Such a modern, it is satisfying those conditions consists of wall, ceiling, and capable of incorporating. So you just, everything is taken care in this system. That is all just because in addition, modular with high availability extension providing the introduction of new facility in the future. These are all the recent advances and all the things going on. What is wrong using chemicals? I'm almost coming to an end. We often see cleaning staff apply disinfectant and then immediately wipe it down without letting it stay wet for the required dwell time. This is everything. Contact time is very important. The misstep is often attributed to the pressure of cleaning and need to be quickly turned over the room for the next patient. Suppose somebody has a septic case or something has been done, they call that person, you do the cleaning and all these things. No time, next person is waiting and all these things. Just you cannot just spray like a perfume and just get away. It has to act, then only it will have a contact time. Please remember, every chemical the doctors are buying, the literature contains a contact time. Are we misusing chemicals? Yes. Changing attitude because of the COVID-19 scare, hospitals are taking close to the disinfectants. And there are a lot of things have changed with the COVID, because entire COVID, I told you the most amount of money in the hospital spent on the disinfectants. So recently, Centers for Disease revised the recommendations for the RS, and also recently there were some deaths with when the Candida RS is coming, a new infection is coming, and it is a multi-drug. Recently, it was in the news from the CDC. In US also, there were some outbreaks of Candida RS. Please remember, in an average laboratory, even in a teaching medical college, we cannot diagnose the RS. There should be a chrome agar or some molecular methods. So last week also, I taken this question, growth of ultraviolet disinfecting technologies. Please remember, I put one picture, the most important effect of UV light on your eye, and it can damage your eye. Gradually, you develop a iatrogenic cataract. The people who are this thing, it is important to remember, but it is only can be a supplement. So next step of things are coming, enzymes, antimicrobial enzymes act as a human taste contain lysozymes. Suppose you see Most important thing is, suppose just a point to this one. Our eye is exposed to hundreds and millions of bacteria and all these things, but it rarely get infected. How many people have got eye infection? No, please remember the greatest saver of the eye is the enzyme. If you have a dry eye, you get infected. Dye is peptidoglycan and this one. Enzymes to control microbes in the environment. And like enzymes are also coming. Prionzyme, now it is coming one thing. Prions also. Prions, as you know, I mentioned it is to be autoclaved at 131. And sometime back there were cases of prion disease in UK with neurology. So you can imagine that cost of the equipment which you use on the surgical instruments is very expensive. So now the prionzyme, a type of enzyme, you put that instruments in that one, it can be this one. Then is in recent years, we see new cleaning chemicals, including the everything, it is coming there, it is still yet to come and all these things. There are a lot of chemicals, you can look to the literature. And India, still, I have to best of my knowledge, I have no idea about it. India released, and what India doing is there and all these things. India released the 4th draft of chemical management select groups in 2020. 4th draft and all the draft rules include significant revisions in the priority substances. Suppose now it is becoming a environmental, raising the voice about the systems and the hospitals and all these things. So India is also going to have certain regulations. Even they will soon may incorporate into NABL and NAB. So life at risk. Suppose somebody ask me, a person with a head injury coming to the hospital, the most important place where their life is beside is the casualty. Please remember, it is not in the surgical operation theater. And many times you miss something and without a proper thing and all, either doing a suturing, you did a wrong suturing, wrong cleaning, and everything is there and all these things. And casualty is the face of the hospital. That's very important. Suppose if some accident happens, 50 people will come and enter forcibly into the casualty. Please remember, these are the people who really are more dangerous to the person who is affected. We have no control. And casualty is the index of services also. However, good organization practice, casualty is the index of hospital emergency. And also, please remember, a child comes with a diarrhea to the casualty. It is a very common practice in the night. If you have at least 1 or 2 admissions, a child with a diarrhea, a child passing the stool around, and this is the cause of the gram-negative bacteria plenty and all these things. What disinfectant used for cleaning? These are all the things which you are all very know. We are using left and right lysozyme and all these things. So to end near to this thing, no additional precautions. We have to just do this. First, that thing must be moved out from that casualty where this thing. You cannot throw the dressings on the floor or wherever you apron and all these things. So I just want to tell one thing. There was recently a discussion. The people are entering into the casualty with an apron. Whether you need an apron, which you see the person wakes up, goes to the canteen, goes to the toilet, goes to somewhere around the hospital, then comes to the casualty with the same apron. Is the apron infectious? And there were so many things happening, whether you wear a half-sleeve apron or a full-sleeve apron. But one thing is there, we also told there was a lot of studies on apron. People are not washing the apron for about 1 week. They change their shirt to be smart every day or dress, but they don't use the apron. Apron is a source of infection, goes to the hospital, can infect your child, or it can be the single. So it's a matter of 90. If you come to the end of the talk, is the infection is a very simple thing to control in the beginning, and it become monstrous and can end to life. It's not an ending issue of this thing. Infections are not going to end. They can only be reduced. And there are a lot of things. Our clean hands is a patient in casualty. There are so many impressions of the infections and all these things. Still, a patient comes, we just spend some this thing. I told you about a person wearing some time back. If you wear a full hands, sleeves, more infections. Have this thing and all. See, it is all this thing. So we have a humor. We always practice. This is a very nice slide from Amul. They said this little baby is serving a cheese or a butter or a bread, and she is telling always compulsory sterilization is practicing. So these are the references, and thank you very much. So the first question from Dr. V.K. Sharma ji, Bihar, best way to disinfect hospital premises. See, premises means entire hospital is a very huge area. The most important care to the casualty where everything can enter. And also, please also do remember, premises you told, you see the people use the mops. The mop should be specified to that particular. We have to use 3 bucket system when you are cleaning the mops. Suppose you are taking the same mop on the veranda, and if you are going to take to the dressing room the same mop without cleaning or sterilization. So please also remember one point I want to tell: when you are handling the mops, please put in a hot water. That is may not, but dry mop. You don't keep the mop on the floor that where that fibers are there. You have to keep it on the just on the upside so that they get dried. Please remember that mops which are very wet all the time and cleaning, it is the most important cause of pseudomonas. And also that the critical areas, you should keep the mops separate and you should not use the same mops. As far as floor is concerned, see, a person in an ICU don't get infected from the bacteria on the floor, but increases. Dr. Geeta madam, how long to sterilize linen and instruments? See, this is a very, very big question, madam. The entire laundry system depends upon this one. But one thing is very certain. Washing, more than washing, drying is very important. See, in linen is the one of the things now the very modern hospital has a modern this one, but it is there and all. See, they're all, when there is no contained facilities, people are drying on the roadside also, hospital things. They're all been catch up with that sports and all these things. That is very important. You dry this one without ironing, if you are using, it's very dangerous. This thing. Is formaldehyde carcinogenic? It is much proved in the animals, but we need a long study, madam. Now, nobody is sticking to a particular job for a long time. Suppose if you take to our employees who worked in the operation theater for 40 years or 50 years, I have not seen much somebody saying a nasopharyngeal cancer. This is a controversy because America goes too high with their expectations. But you see, in India, it is sophisticated chemicals using is very difficult. I think formaldehyde, still we use it, but we need a study. Suppose somebody working in a theater with a formaldehyde served for about 10 years, we can find it. But see how much you are exposed. But one thing I am very much certain, we are not using even formaldehyde, we should not use. We are using in a very unscientific way. All that is leaking and all the people around it get exposed, but we are not getting the results needed for cleaning the system. Thank you very much.